Okay, first is the epicranial muscle. It is also known as the epicranius. It is a muscle of facial expression in the scalp region. This muscle and its tendons are one of the layers that form the scalp, so it's literally right up here. The action is to elevate the eyebrows and wrinkle the forehead skin, so like this. Next is the orbicularis oris. This is an important muscle of facial expression in the oral region since it acts to shape and control the size of the mouth opening, and it is important for creating the lip positions and movements during speech, so it's right here. And it creates like the pursing or like the pouting look or the kissing face, so like that. Next is the orbicularis oculi. This is a muscle of facial expression that encircles the orbit, so your eye. It closes the eyelid or squints, creating the crow's feet at the lateral canthus, so like this, right there. Next is the corrugator supercilii. It is a muscle of facial expression in the orbital region, deep to the superior part of the orbicularis oculi muscle, so it's like up here a little bit, and it wrinkles the eyebrow muscle, so like that, I'm assuming. The buccinator forms the anterior part of the cheek or the lateral wall within the buccal region in the oral cavity, so like right here. It compresses the cheeks when chewing food, so it pulls each labial commissure laterally and shortens the cheek vertically and horizontally. So like, just, I don't know, however you hold food in, compressing, chewing. Next is the risorius muscle. It's a thin muscle of facial expression in the oral region that acts to stretch the lips laterally to retract the labial commissure and thus widen the mouth. So it runs like right here and it's a little bit thinner. It produces a grinning or smiling effect. So I guess when you smile or grin, it's what pulls your labial commissures back. The levator labii superioris is a broad, flat muscle of facial expression in the oral region that originates from the infraorbital rim of the maxilla. So it runs like more like right this way, and it lifts the upper lip muscle. So I can't do it, but it would lift that up. The levator labii superioris aliquae nasi is a muscle of facial expression in the oral region that originates from the frontal process of the maxilla, so it's more like runs right here with your nose. It elevates the upper lip and the ala of your nose, thus dilating each nostril. Kind of creates like the snarling look, which you can't really do that well. Next is the zygomaticus major muscle. It originates from the zygomatic bone lateral to the zygomaticis minor. And it helps, it creates like it's the muscle that helps with smiling, so, and it runs like, kind of like this. And then the minor one, is a small variable muscle of facial expression in the oral region that originates on the body of the zygomatic bone medial to the zygomaticus major muscle, so it's a little bit closer to the midline, and it does this pretty much the same thing. It just helps assist the upper lip in smiling. Next is the levator anguli oris. It is deep to both the zygomaticus major and minor muscles that it originates in the canine fossa of the maxilla, usually superior to the root of the maxillary canine, so literally like right here. It elevates the labial commissures when a person smiles, so that. The depressor anguli oris is a triangular muscle of facial expression in the oral region that originates on the inferior border of the mandible, so it runs more like this way. It depresses the labial commissures when a person frowns, so pulls that down. The depressor labii inferioris is deep to the depressor anguli oris muscle, so it's pretty much the same region, just a little bit deeper. It depresses the lower lip, exposing the mandibular incisors, so that. Then you have your mentalis, which is right here. It is a short, thick muscle of facial expression superior to and medial to the mental nerve in the oral region that originates on the anterior mandible near the midline. So like I said right there, it raises the chin, wrinkling its skin, causing the displaced lower lip to protrude, narrowing the mandibular vestibule to create the peach pit dimpling over the skin of the chin. So like that kind of. The platysma, it is like right here. It's a facial expression muscle that runs from the neck all the way to the mouth, superficial to the anterior cervical triangle and external jugular vein. It raises the skin of the neck to form noticeable vertical and horizontal ridges and depression. Also pulls both labial commissures down when a person expresses horror or disgust. So it's like scared. The last two muscles, they are mastication muscles. So we have the masseter, which is the most superficial and one of the strongest muscles of mastication. It is broad and thick, flat, rectangular muscle on each side of the face. So it's like right there. During bilateral contraction of the entire muscle it elevates the mandible and raises the lower jaw. During EO and IO, we can have the patient like clench and we can check that muscle. The last one is the temporalis. It is a broad fan-shaped muscle of mastication on each side of the head that fills the temporal fossa and is located superior to the zygomatic arch. So it's like, it runs like right here and it's fan-shaped. If the entire muscle contracts, the main action is to close the jaws. This muscle also maintains the mandible in its physiological rest position, allowing for freeway space. So I guess it just holds it in its basic normal resting position. That's it.